So we have been...
Hello and namaste. Welcome to our special Facebook Live series, along with best wishes to each one of you on International Women's Day. This is Dr. Srinidhi Chidambaram here. Mahatma Gandhiji said, "It is health that is the real wealth and not pieces of gold and silver." But communities and countries and ultimately the whole world would be only as strong and healthy as the health of their women. Thus, there is a strong case for the immense need to foster women's health. There are also a lot of scientific reasons why we have to discuss women's health needs specifically. Women have unique risk factors. They have unique propensities to some diseases apart from all their reproductive health issues. There are external societal factors that may be influencing women's health more than men's. And then there are certain symptoms for diseases which aren't always recognized in women or which may be different from those of men and may go unnoticed. And of course, women have special needs when it comes to their healthcare and also very prone to ignoring and putting off seeking healthcare. So it is unquestionable that women's health is a special category that we have to consider by itself. And it's also essential that women should strive to learn as much as we can about our bodies and about our health. So today we have organized a very special session where you can ask us anything about women's healthcare and health issues. And the most relevant and factual information will be given by none other than renowned obstetrician and gynecologist and surgeon, Dr. Rooma Sinha. She's a senior consultant gynecologist, laparoscopic and robotic surgeon from the Apollo Health City, Jubilee Hills, Hyderabad, and is one of the most renowned gynecological surgeons in India with the largest experience in performing robotic gynecology surgery. She is honorary professor, Apollo Hospitals Education and Research Foundation, conjoint associate professor, Macquarie University, Sydney, Australia. She is distinguished clinician from Apollo Hospitals, editorial board member, Gynecological Robotic Surgery Journal, board member of the Asian Society of Gynecological Robotic Surgeons, mentor and proctor at several centers, including the FOGSI Endoscopy Center for both basic and advanced. Dr. Rooma Sinha has a flair for gynecological surgeries and has a reputation for performing very complex surgeries as well. The FIGO Fellowship at the University of Rochester, USA, and the FOGSI Fellowship at the Mercy Hospital, Melbourne, gave her the international perspectives. She has experience of over 26 years in laparoscopic and hysteroscopic surgery. She pioneered robotic surgery in India since 2012, and today is the most experienced robotic surgeon for benign gynecological conditions in the country. Recently also published a simple reproducible technique to do robotic hysterectomy, which has been named the Sinha Apollo technique. She is the clinical lead specialist in gynecology for Macquarie program and enjoys teaching as well, the director of Minimal Access and Robotic Surgery Fellowship program at Apollo Hospitals, Hyderabad, and always believes in constantly learning by mentoring young surgeons, published many papers, and has the distinction of being invited as a lecturer to almost every part of India and the world. Also the recipient of several distinguished awards, such as Excellence in Medicine by FICCI, Legend in Gynecology by Times Healthcare, and by many other forums. Welcome, Dr. Rooma Sinha, and thank you so much for joining us today to answer any questions about women's health. It's been truly an honor, and I'm delighted to welcome you to this Facebook Live session. Over to you now. And then after your overview, we will then take the questions.
Yeah. Thank you, Dr. Srinidhi. Thank you for your very kind words. I'm humbled today to be speaking to women and as well men on this very, very important day called the International Women's Day. I believe each day is Women's Day, but yes, it's also important that we give some focus to the difficulties women have in their personal and professional life, the marginalization that they feel, the difficulties economically or otherwise. So bringing a focus to it gives us an opportunity to work towards their well-being. And rightly said, Dr. Srinidhi, physical or health is probably the most important thing that we can actually give to ourselves. So let's begin by understanding that's not a selfish thought, that if we want to give some time to take care of our health, maybe go for a physical checkup or meet a gynecologist or anybody else, but somehow women just shy away from it, put their own health needs to the back burner, probably prioritizing the health or needs of their family, husband, children, neighbors, even the dog sometimes, and they just don't look after themselves. It's like the airplane analogy. If you remember when they announced that if there is a reduction in oxygen pressure, the masks will prompt, please wear your own before you help the others. And that's exactly true for women's health too. Look after yourself. If you are healthy, smiling, physically, mentally, emotionally strong, people around you will be absolutely healthy. So that's something which we are gifting to ourselves and people around. Well, prioritize your health at every stage. And let me begin an overview that we talk about from girls who are in their teenage times, right from the time they actually enter their menarche, which is happening very early these days, maybe 10 and a half, 11 years. So small girls, they have to understand the responsibility that they have now. So starting an early menarche, irregular periods, painful periods, this is the time then the family needs to make sure that this girl gets the right attention. The other things that girls of this age are often addressed to are body shaming because of probably unwanted hair, abnormal body structure, or they're just growing, they're awkward, weird. We need to make sure that these girls develop their confidence and do not go into that wrong path of having some kind of anxiety, depression, or some body shaming kind of situation. So that's something other than just physical health, builds their mental and emotional health too. Once we cross the teenage years, now we are in the so-called reproductive or the most happening years of your life, the 20s and the 30s. You're busy graduating, searching for a job, establishing yourself in the profession. But remember, there's a health need there. There's a need for contraception. There's a need for, if you're pregnant, to go for the right treatment. There's need for vaccinations. So you remember that these are maybe preventive at this time, but you need to look into it and make sure that you have the right means and access to do it. Today, if you don't have time, every gynecologist or physicians are available online. We have a 24/7. You can connect with anybody in your off time, but make sure you make an effort to do that. Once you cross this time, then you are in your 40s and 50s. Many of them have finished their pregnancies, childbearing, settling down, maybe in a higher position in their professional graph. But remember that this is the time when some gynecological diseases can trouble you. Believe me, a lot of women in this age group come to me when they have really pushed their boundaries. They are low on hemoglobin, bleeding because of fibroids or endometriosis, but they think, oh, next month will be better. Let me take this forward. But if you keep on pushing, low hemoglobin, fatigue, your irritability, your inability to achieve and do what you want will probably get you. So remember, today we have avenues to help. We have simple medications, simple interventions. And even if you end up to having a surgery, as Dr. Srinidhi said, we are now equipped to make you up on your feet even in a day, probably call you in, send you home by evening by doing minimal access surgery on a daycare basis. So don't shy away from your problems. Make sure somebody sees screening for cancers, breast cancer, cervical cancers, getting the pap smears done, mammography. These are all which require attention in your 50s and 60s. And there comes what we call is the evening or the ending. But it's not the end. Today, menopause is the time when we are thriving. So we must make sure that we are in the best health at that time. We do not want to become, again, gifting yourself the best health. That's the time when your children are settling down. If you have best health, you are happy, they are happy. So why don't you gift yourself and your children that? Make sure you have adequate physical checkups. Non-communicable diseases like diabetes, hypertension, thyroid disorders, these are very, very common problems that can take place, but correctable. One must take care of them. Postmenopausal bleeding. This is something which I always talk about. Women tend to ignore, but it could be a clue for an underlying serious disorder like a uterine cancer. Detected early, breast cancer or any other problem, we can help you completely get onto your feet and treat it completely. So these are some of the issues on an overall, which I feel women right from the teenage to their later ages should take care of. And that's what I would like to stop right now and see what questions are coming from all of you.
Sure. So let's then get to the questions. What are some of the common women's health issues?
As I said, mentioning from the age group, depending upon which age group she is. And many times we must understand as physicians and as gynecologists that women come to us with some problems. We find some problems, right? But the treatment for these women is the problem that they have presented with. And that's something which I teach and I also practice, that when women come to me with their problems, I ask them, what is your primary problem? Now, the primary problem can be basically 3 or 4. They can get subdivided. Heavy bleeding or problem with bleeding, pain in their pelvic areas, backache or something of that sort, unable to conceive, severe pain during their periods, or they are having some kind of additional medical issues complicated by gynecological disorders. The underlying problems that can these women in young age commonly face by is polycystic ovarian disease or abnormal bleeding because of fibroids, endometriosis causes severe pain. These are some of the common gynecological problems that women can face.
What is so unique about women's health? I mean, of course, we do talk about men's health, but women's health is somehow always segregated as a special category, as it should be. But what is unique about, the health problems that women face? Is it so very different from men? Apart from the gynecological ones, of course.
Right. So I would categorize the problem that women face both physical and in the mental space. So in the physical space, we are privileged to have uterus, ovaries, so that we can reproduce, and we are the ones who take the generations ahead. But they also come with some problems. So things like breast disorders, uterine disorders, ovarian problems are not in men. So other than having the common problems like hypertension, diabetes, or heart disease, or any other problem, we are destined to have some of these problems. And that is the reason why we must make extra effort to make sure that we are not ignoring these problems. Coming to the mental space, we also know that women suffer with more mental disorders, right from stress to depression to anxiety. Women are prone to have more problems. This should be recognized by physicians, society, women themselves. Because unless we recognize that this problem, believe me, Dr. Srinidhi, many times women come to us and they'll tell me 10 problems. As I'm listening to them, I understand that it's not fitting the picture. There's something else going on. And when I bring out this topic that, are you having these symptoms of maybe leading to an anxiety or depression? Most of the time I find them nodding and literally understanding and grappling that, yes, this is what is really bothering me, but I'm just coming with other problems because I don't want to address it. So it is important for society to look into these things, and that is why women's health is so very important. We need to empathize with them and understand.
Yes. One of the common issues that people have is vaginal discharge. So what is normal and what is kind of abnormal? How do you know the difference?
Vaginal discharge is a perfectly normal discharge. It's like discharge from any other open cavity in your body. Could it be nose, mouth, or whatever? So if you don't have vaginal discharge, the vagina becomes so dry that it could have problems. So vaginal discharge is perfectly normal. When you need to worry and reach a gynecologist for evaluation is one, if the discharge has some kind of bad smell or a foul smell. Second, if it have some kind of itching or pruritus as we call it, or if it is blood mixed, or if it is very excessive and you are not able to control it. So little discharge is normal and physiological. Don't bother. But if you have any of these signs, make sure you get evaluated by a gynecologist.
There's also this kind of, some people believe that you must use some deodorants and, what is your advice to people who want to think that, they must make sure that there is no feminine odor or any kind of, is it really required to kind of do all these things?
Well, if you look at the animal world, the odor is important, right? That's what distinguishes you as which gender you are, which species you are, and so on and so forth. So some body odor is again physiological and normal. Some people have this a slight judgment about what type of odor am I emanating, or should I do something to hide it? Well, if the odor is not bad or not suggesting of some disease, then we must not overdo in using feminine products, or even douching or things like that should not be used. For the simple scientific fact is our vagina has some protective mechanism in terms of lactobacilli. People who use a lot of these products or douche their vaginas too much or use too much of water to clean actually lose their protective mechanism, and then they are more prone to infections. So it is not advisable scientifically to use these products.
When should a woman have her first gynecological exam?
All right. If you look at the international recommendations, it usually says 13 to 15 years. But if you talk to our mothers, they will be a little scandalized that why should I take my daughter at 13 years to a gynecologist? I'm still taking her to a pediatrician. That's a denial mode, actually. But yes, let me become a little bit more. Maybe by the time your daughters are reaching to go to college, it's a good time to actually take them once to a gynecologist. Not because of any other thing, but remember that knowledge is power. Their daughter can learn so many things about herself and how to protect herself and how to take care of herself from a gynecologist's advice. So I would suggest that may be the right time in our Indian scenario to visit once.
What are the health screenings that are actually important for women, and would that be according to age categories?
Yes, a little bit of screening matters with age. Other than all the normal screening for the non-communicable diseases or anything else that we do for average men and women, women especially need screening for breast, any kind of lump or any diseases of the breast. We need to have screening for cervical problems, which we normally screen by pap smear. We may even need to screen by a screening ultrasound for the pelvic organs to know if there is any other problem developing. I would suggest that, although not in most screening programs, one must screen women for osteoporosis as well, yes, because women are more prone to osteoporosis. And if we detect them at the right time, we can treat them and prevent them with the long-term morbidity of fall and fractures. So these are some of the things. Some screening can be done for if the women are developing urinary incontinence, because this is also a common hidden problem which women don't come forward to. So that's few of the things that I think screening should address to.
What about the pelvic exam, as in a vaginal examination? Is that necessary for all women who are going for these screenings, or is it done only under certain special circumstances?
Okay. Vaginal examination should always be done if there is a complaint. So if a woman comes with complaint of discharge or some discomfort or something in her vagina, I think it is not right to be an armchair gynecologist and just give her a medication and not examine, because we are missing out important information. So gynecological examination is a must if a woman comes to a gynecologist, and we must be very, very sensitive. And I often talk to women and make sure, most of the women, when you move out of my office, they say we never realize it will be that easy. They're worried, and that's why they avoid it. The second thing is that a routine yearly gynecological examination can pick up things which would have otherwise not come into our attention if we had not done. So if you talk about preventive health, a yearly gynecological examination, I think, is a good idea for all women to undergo if they have the access to healthcare.
Coming to a little bit about the diseases of the breast, particularly cancer, what is a mammogram and how often and from which age do they need it?
Breast cancer is on the rise in our country, so we must be aware of that. If your family members have breast cancer, then you are obviously more predicted to develop a breast cancer. But we are also seeing young women without any family history coming with breast lumps, and which turns out to be cancer. So one needs to be aware. The best part about breast is that it's an external organ. So you have the ability to evaluate your breast yourself, which we call as breast screening. That will be the simplest way of taking care of your breast. You can evaluate and palpate and see. That's what we call a breast awareness or breast examination. But once we have that, we also have some imaging, which is called mammogram, which can be done. We can do an ultrasound of your breast, or if we can do an X-ray of your breast. X-ray is what is classically called as mammogram, and it is usually recommended for women beyond 40 years. Before this, if you have a problem or we want to screen, we generally go for an ultrasound. We can reduce that to 35 depending if you have a strong family history. So X-ray or a mammogram tells me about how dense your breast is, if there is any lump that is developing. It can probably pick up in a good center diseases of the breast, particularly cancer related, before you can actually palpate it. So that's the advantage of a mammogram.
And you have it every year after the age of 40, or is it like?
Not necessarily. That there is no recommendation to have mammogram every year. If the mammograms are normal, you can even repeat it at 2 to 3 years interval. We do a risk profile of each patient and understand what is a risk of developing cancer, and then probably arrange how quickly she should have. But every year is not recommended.
Why are the periods of some women alone so heavy and with clots? Is it normal?
Heavy periods is a subjective description. So if you think that this is what is heavy today, was heavy always like that? Probably not of concern. If you had lighter bleeding, now you think it is heavy, it's a matter of concern because something is changing now that's causing it heavy. How do you understand that it is a clinically significant heavy? One, you'll be using more protection. That means you'll probably be using your pads or tampons or menstrual cup more often. You will be passing more clots and you may be having bleeding for more number of days than you were having before. So these are all for you to understand that your periods for somehow has taken a turn for it to be heavy. And then you must consult a gynecologist.
The other thing is also a name which we all hear a lot these days is the PCODs. And then there's also this whole irregular periods, delayed periods in women. So what is considered to be normal, and what are the different more reasons why somebody would have a delay in their or sudden irregularities or absence?
Okay. Yes, PCOD is something which is very, very commonly talked about. And it's also talked about because we are finding more women who are suffering from this condition. You have to understand, I just mentioned the word condition specifically and not disease. So it's a condition of your body. We have to understand that PCOD is a hormone related condition of your body with a background metabolic error. I know it's a complicated word, but try to understand that PCOD will not go away from your body by just taking some hormones or some treatment. It's a condition of your body. This condition has some link to genetic diabetes. So we have an insulin resistance, which doesn't let the hormones go well, and that can give you an end result of not having periods regularly. So when you walk into our office, you'll say, I'm not getting periods for 3 months or 4 months, I didn't get period, and I have an ultrasound report that says PCOD, so I have PCOD, what to do? That's the common concern. The other concern that can have is with this irregular period, you may have hirsutism, you may have more hair, you may be obese, you may have acne. So PCOD is diagnosed by having some of these conditions when they occur together. One is a clinical diagnosis of anovulation. That means you are not producing eggs. Cycles are not regular. There is delayed cycles. Second, clinical or biochemical evidence of hyperandrogenism. That means you have more male hormones in your body, which could come either by doing tests or by seeing more hair and things like that. And the third is the ultrasound report saying it's a PCOD ovary. So these are 3 or 4 things that when they combine together, then we come to a conclusion. However, as I said, removing PCOD from your body is no magic. And the ball is always in your court. Why? Because it's a lifestyle problem with a genetic disorder. I can't change the genes. I can't change who you are. But you can control it by adequate diet, exercise, and maintaining the correct weight and BMI. And believe me, many of these young women who follow this advice, their irregular periods become regular. If they are unable to conceive, they conceive. Their other things come down. We can, of course, help you at every stage. If you're a young girl bothered about hair, I can give you some treatment to temporarily manage that. If you're a young woman bothered about not getting period regularly, I can give you hormone treatment to get you right period. You are in your 20s or 30s, PCOD not letting you get pregnant, I can give you a pregnancy. You're in your older age, these irregular periods giving you abnormal bleeding, I can treat that. But remember, nothing will work till you work out. So that's important to remember in PCOD.
Right. So the other questions about the period is how often should a woman be menstruating?
We should be menstruating if you go clockwork every 28 days, but that doesn't happen. So any time between 26 or 24 days to 35 days is considered to be more or less a normal. So if you bleed every month like a clockwork, then you will probably have 12 periods every year. But even 10 periods a year is more or less okay. So that's how regularly you should menstruate.
Well, is it possible to get pregnant during your period? I'm not sure what exactly it is.
Okay, let me try to break down this question. Does it mean that while you're menstruating, if you have sex, can you conceive? Is that the question?
I suppose.
Okay, that is the okay. If that is the question, then you probably can not conceive while you are menstruating because you are not going to release an egg. You can only get pregnant if you have sex around the time of your periods. Oh, sorry, around the time of your ovulation, which is usually mid-cycle, but it can be here and there. The other thing is, I will just twist that question because I want to put this point across to our viewers, is sometimes you may get periods, but you are underlying pregnant. You're trying to understand what I'm trying to say? Okay, you had a good period. The second period was lighter. You thought it is period, but it actually you were already pregnant. And these situations can be a pregnancy which is not really very good. So you had some bleeding, and sometimes it can be a clue to diagnosis of ectopic pregnancy. So if your period were not as good as your original period, and you're a sexually active person, then make sure you do a pregnancy test to make sure that you're not pregnant underlying. So that's something important to know.
What causes bleeding between the periods?
There could be, usually in between the period, there could be either a hormonal issue or could be a anatomical or structural issue in your cervix or uterus. Hormonal issues can be irregular ripening, or the hormones didn't come, so the lining didn't form well, and there could be breakthrough bleedings. But sometimes cervical erosion, cervical polyps, or some growth in your mouth of your uterus, or some polyp or something inside your uterus. So anatomical problem can also give rise to abnormal bleeding or intermenstrual bleeding, as we call it.
How do I know when menopause starts?
Well, you'll know when it starts because it's a retrospective diagnosis. We call or we define menopause when you don't get your periods for one whole year. So it's a retrospective. I can't predict. So you have to wait for one whole year, maintain your diary. If you are for one whole year did not get your periods, consider yourself menopause. But there is always a premenopause phase, then there is a menopause, and then a postmenopause. So you can have a run up to menopause going up to 2 to 5 years where periods will be regular. You may have some changes, some symptoms. So you'll know that you're leading. However, we can do a blood test and we check for the levels of follicle stimulating hormone or estradiol levels and can roughly tell you whether you are going into menopause or not. But you have to be having absent menopause for 1 year for yourself to say you're in menopause.
Now, the symptoms of menopause, one important one is the vaginal dryness. What are the other symptoms, and also like what can be done about these symptoms?
So you are very right, Dr. Srinidhi, and whoever has asked this question, these are the two most important distressing symptoms women face in menopause. One is this vaginal dryness, which we actually term it as genital syndrome of menopause, GSM. And the other is the hot flash. These two actually bother women so much that their day-to-day activity is, like affected. So hot flash is something where you will feel suddenly a sense of heat and cold sweats. It will interrupt whatever you are doing. Suppose you are teaching, you have to interrupt yourself for a minute to let that hot flash pass, or if you're doing anything else. So this is something that affects and we may need to treat. The dryness of vagina is basically again because of lack of hormones. The vaginal tissues dry up. There is no, as I said, vaginal discharge is important. The vaginal discharge is gone in your menopause, so that's the source of trouble. Both of them can be treated with some medication. For hot flush, we would like to give a hormone replacement by medication, but the vaginal dryness can very well be managed by local treatment, and the first line usually is just water-based lubricants or some kind of thing that can help. If not, then we can give vaginal gels which contain estrogen as well.
What is the role of the hormone replacement therapy? Because it is who will benefit from it? Because one has always heard about, the side effects and, the long-term effects of hormonal therapy. So is it for everyone, or who is it for really?
In a very practical sense, hormone replacement therapy is definitely indicated for women who go for very or get a very early menopause, like it's premature ovarian failure. Say by 40 or 38, you are already in menopause. You had another 5 years or 6 years to go in your regular work. It is good to supplement them because otherwise they have long-term effects of hormone. The second reason for giving hormone replacement therapy is to treat the symptoms, like I just mentioned, hot flash, genital problems, any other problems. Very rarely we treat or give hormone replacement therapy for women who have very, very weak bones. And that's why screening for bones is important, because estrogen is important for bone health. That's not a very common indication, but we may give. It is really not indicated as a secondary prevention for heart disease, because we know that estrogen protects our heart, but it's not necessary, or we don't recommend that women take estrogen just because their heart will be strong. You can do other things to make your heart strong, both physically and metaphorically as well.
How can one control the mood swings during the period?
It's called a premenstrual syndrome, or sometimes it can even become so much that it affects your day-to-day activity. We call it the premenstrual dysphoric syndrome, PMDD. Medication is always the last resort because it's going to happen to you every month. We need to understand what triggers it. Of course, the menstrual cycle, but there will be other factors. Try to address to those factors. Try to make sure that you're physically active. Some kind of stress release activity is happening. It could be a hobby, it could be meditation, could be anything. But if these things don't work, then we ultimately would like to give you some medication to tide over this crisis. It's a genuine problem in women. We must address it.
Doctor, very often I'm having pain in my underarms. I did a self-examination, but there is no indication of any lump. So what further diagnosis can be done?
Depends upon the age. Pain is usually not a sign of cancer. So we must understand, usually breast or axillary lump, if they are cancerous, they are often painless. Painful lump could be some kind of infection in your armpit, in one of the lymph nodes may have been infected. So that could be giving rise to pain. If you are unable to examine anything, maybe you can have an ultrasound examination of your breast and the armpit, or maybe see a physician who can probably evaluate and tell you what the pain is doing.
Is pain during ovulation, which I have got a few years back onwards, is it something to worry?
No, it's a good sign that you're ovulating. So it is a very, very normal pain. However, if the pain is so much that it is affecting your ability to do your regular work, then you can take a simple painkiller like a non-steroidal paracetamol or something. But you can do anything about it.
Will changing the lifestyle, that is diet, exercise, smoking, drinking, help in avoiding certain diseases like depression and heart attack?
But yes, of course. And when we talk about lifestyle, these are the common things that we think of. But remember, lifestyle also talks about exposing yourself to some kind of sunlight, maybe even moonlight, sleeping at the right time, sleeping for the right hours, right? So when we talk about lifestyle, everybody just talks about diet, exercise, and maintaining good health. But these are also interrelated to, yes, you did speak about smoking and even contrabands. You should not unnecessarily use those things. Make sure you drink plenty of water. Make sure you sleep at the right time. So these are also addition to your good health. So remember to add these things to your, and definitely they will reduce your chance of any cardiac disease or any other non-communicable disease that you may think about.
What are the symptoms of hypothyroidism in children?
The symptoms of hypothyroidism that we classically describe in medicine happens when the hypothyroid is quite advanced or the levels are quite bad. But often because of the tests that we do so often, we catch them much earlier. Hypothyroidism can cause simple things like dryness, dryness of skin, weight gain, can cause abnormal periods, you may have difficulty in getting pregnant. So these are some of the common things that hypothyroidism can cause in your day-to-day life. But it is very simple to diagnose it, get a blood test done, and you know where you are.
What is bacterial vaginosis and how do we prevent and manage it?
Okay, bacterial vaginosis is a kind of vaginal infection. It's one of the commonest vaginal infections that women can face. It's a combination of few bacteria that become more when your own protection comes down. As I mentioned initially, that too much of vaginal cleaning or douching reduces the lactobacilli, which is the preventive bacteria in your vagina. When that reduces, these other bacteria come up. They give a kind of fishy odor, frothy discharge, which is not itchy. So remember that if you have a frothy discharge, whitish discharge, which is not itchy or does not look like curd, but is copious, it gives a foul smell, almost a fishy odor, is usually vaginal discharge caused by bacterial vaginosis. So treatment is very, very simple. We need to identify. That's why any discharge, unless we do a pelvic examination, we will not be able to identify what vaginal problem it is. And treating by simple metronidazole helps. What you take for your diarrhea or something like that. That's the treatment of choice.
We have two more questions. One is about endometriosis and what it is, because it is becoming again one more spoken about term these days. So is it curable?
Okay. And a good question, because although we are talking about International Women's Day, but March happens to be Endometriosis Awareness Month as well. We are talking about endometriosis. Now, I don't believe that there is sudden spurt in endometriosis, but there is awareness in endometriosis amongst women, and there is awareness of endometriosis amongst physicians to diagnose. So both have come together, and that is why we are talking. We need to talk because endometriosis is a lifelong issue. It's a chronic inflammatory disorder that can trouble women right from their adolescent age to their menopause. And in this journey, they can have pain, which is intractable. Either it could be during periods or after periods or just any time, can have their difficulty in getting pregnant, can sometimes lead them to having multiple rounds of treatment, multiple surgeries, and so on and so forth. So understanding what, in fact, only few things I like to address or tell viewers is, if you have intractable pain in periods, even if the girl is young, remember that she must be evaluated. It could be an underlying symptom. Endometriosis often gets delayed in diagnosis because not just pain in periods, it also sometimes presents with very non-specific symptoms. What are those non-specific symptoms? It can be just bloating or nausea during periods or having fatigue, headache. Now, for these, women don't come to gynecologists. They'll go to many other physicians. Maybe for bloating, they might be going to gastroenterologists, which if they don't put this as differential diagnosis, it gets missed for years together. So talking about endometriosis is important because we need to break the silence. Many women suffer with pain and abnormal bleeding because of endometriosis in silence for years together. But they're coming forward and we are looking after them in a much more organized way now.
Finally, how to improve chances of conception?
Well, there are a few things that women need to understand. One, that the minute you decide that you want to get pregnant, don't get rushed. That's the first thing I find. You may be 33 now, but you never tried when you were 28. You are just starting to try. So just think that you are a normal couple. Give yourself some time. Second, maintain your weight. It's very, very important. So that's the lifestyle that we spoke about. Maintain the right weight, eat well, exercise. Third, enjoy. Don't get focused that this cycle I didn't get pregnant and that cycle I didn't get pregnant. My usual advice to often couples whom I find that there is no problem is to actually go on a holiday. And that just clicks and works for them. So enjoy. Third, forget the so many devices, the computers and something once you come home. If you're always on something else, mind is always focused on something else, where is the time to enjoy your sex? And that's what is going to give you the pregnancy, right? Fourth is take supplements. Get yourself evaluated if you think that something is not working. Sleep well. Avoid the alcohol, smoking. Get off all that. And both the partners, not just the woman. Make your husband or your partner also get off smoking, off alcohol. So these are some of the things if you look at. I believe that unless you have a problem which is causing you infertility, most couples will conceive.
Absolutely. On that positive note, I will thank you for this wonderful discussion. And viewers, I hope you have enjoyed the session as well and got a lot of your questions on a wide range of women's health topics answered today. But do reach out to us. We're always available. You can put in your queries, and we're always there across our hospitals for any consultation, virtual or in person. So please do come if you need any additional consultation or support or assistance. Whether deliberate or unconscious, bias makes it very difficult for women to move ahead. Knowing that bias exists is not enough. We need action to level the playing field. So, the theme for International Women's Day this year is to break the bias and cross your arms in solidarity. So, this is what we need to do. So, strike the pose representing the International Women's Day theme for this year, and let's break the bias. Share this picture too, tagging Apollo Hospitals to encourage further people to commit to work together to forge a very inclusive world. And let's all work together to break the bias on International Women's Day as well as in an ongoing manner. Thank you so much. Thank you, Dr. Rooma. So, yeah. Thank you.
Sure. Thank you.